Is it on? Okay, excellent. Woo! Are we sideways?
Nope.
Hey!
We got something right today.
We got something. See, it gets better every time. So I'm Dr. Hogan. This is Crystal. She is a registered veterinary technician here at Premier Pet Care. So,
Woo!
yeah. And we've known each other for a really long time. How many years?
Oh,
A lot.
8.
It's been 8?
Yeah.
I was thinking 7.
I graduated tech school in 2012.
Okay.
So, yeah. And it's 2020. So,
Yeah.
yeah, 8 years.
It's a long time.
It is.
That's
Time
one-
flies when
that's,
you're having
you know,
fun.
That's almost my entire veterinary career.
Yeah.
And it is yours for sure.
Yeah.
Yeah. So there you
How
go.
long have you been practicing?
10 years. I've been practicing for 10 years. Yeah. It's a long time,
It
right?
is a long time. It's crazy.
Goodness. So, like I said, Crystal is a registered veterinary technician. What's the difference between registered and unregistered?
So I had to take 2 tests. I went to school at Sanford Brown. It was an 18-month program, and then you have your national exams, and then you have your state boards. So I passed both of those a very long time ago, it feels like.
Yes.
Yeah.
Yeah. And then what's required of you to maintain your license?
So I have to get 5 years of continuing education every year. And that can be going to different events that the reps put on.
Mhm.
So we do that.
Yeah.
We can go online and do different videos,
Mhm.
and they do quizzes and tests and
Mhm.
things like that. So that's what I have to do.
Yeah.
What do you have to do?
I have to get continuing education hours as well. My state requirement is 10 hours per year, although usually I exceed that pretty easily. I love learning. I'm
She's
a nerd.
always
I love
learning.
learning. I love reading. I love it all. So yeah, it's easy for me to hit that.
Yeah.
No big deal.
When we're not seeing appointments, she's usually on one of the veterinary pages, just scrolling through, looking at stuff.
Reading, yeah,
Yeah.
reading all the things, whether
And then-
it's business related or medicine related, it doesn't matter. I just read it all.
Yeah.
Mm-hmm.
And then usually we're like, hey, what is that? Learn us something.
That is what you say. You say, learn us something.
I do, every time.
And then I go to the whiteboard and I draw something
Terrible.
really awful. I'm not an artist at all, but I draw. I do.
She does. She tries.
It's close enough. For government work, it's
Yeah.
close enough.
Yeah.
It's fine.
She's like, well, it kind of looks like this.
But we learn stuff all the time. Yeah, and we
Yeah.
usually, it's informally. We do just like Crystal said, hey, we've got some downtime. Let's learn something new. Sometimes we do it as part of our monthly staff meetings. We'll learn a little bit of something. So keeping everybody up to date. It's good practice for them, even if they've heard it before.
She's taught me the heart like 6 times. The flow, and for some reason I just can't remember
It
it.
just doesn't stick.
No.
It doesn't. That's a hard one though.
Yeah.
The heart's difficult. It's very, yeah.
I'm getting there.
Yeah.
I think I've got like 3/4 of it, I think.
Yeah, yeah.
Don't ask me, but I think I've got it.
Don't test you on
No,
it.
no,
Great.
no.
Oh gosh. So you're also a mom.
I am.
Yeah. Tell us
Yes.
about that.
It's challenging.
How many kids do you have?
I have 2. I have
Okay.
2 boys. I have a 5-year-old and a 5-month-old. Their birthdays are actually 3 days apart, so that was really poor planning. We celebrated my oldest's birthday in the hospital.
Yeah.
In the waiting room.
Yep.
So
That was cute though.
It was cute. He
Yeah.
got this giant dinosaur.
Yeah.
That actually
He
moved.
loved that.
He did. We thought that it walked, but we haven't figured out. If it does, we haven't figured it
Yeah.
out yet.
But the head moves up
The
and
head,
down,
yeah.
and the tail moves and opens its mouth.
Yeah, he
Makes
eats
noises.
leaves
Makes
and
leaves. Yes.
yeah, it's fun. My son thinks that he, the people that ride like trick ride on horses. He
Mhm.
thinks he's a trick riding
Oh, the
dinosaur man.
dinosaur.
Yeah,
What kind of dinosaur is it? Is it
it's
was it a triceratops? That's right.
Yeah, so he loves that.
Mm-hmm.
He also has more energy than like 4 people.
True.
I don't understand how he does it.
Yeah. His favorite thing to come when he comes in here is he finds one of the stools rolling around because they have the best wheels on them. They have like almost like rollerblade or skateboard wheels. They're crazy. So he hops on those and goes running around, and I just pray that he doesn't slam into something and break himself.
Or anything else.
Or anything else. More worried about him than stuff. But yeah, he's got a lot of energy.
He drives me crazy. I love him. I love him.
He's
to death.
cute. Well, I got to make cookies with him this past summer. That was fun. I let him make his own recipe for the cookies. I just put everything out, all kinds of stuff. There was sprinkles, and there was gummy worms, and chocolate chips, all kinds of stuff. He didn't add any flour. He didn't. I don't remember if he put sugar in it or not.
There was enough sugar in
enough
those cookies.
There were marshmallows. He melted the marshmallows. He put nerds in there. He strangely chose to add goldfish to the mix. So he mixed that. He used the electric beaters. He had a blast. And then we had to put it in the microwave and melt it, and then mix it some more.
I don't like mess.
Aunt Kelly loves messes. It's fine.
She does. She was like, "It's fine. We'll just do it at my house."
We were outside. We were outside for most of it.
We were
can just hose it all off. It's fine.
In the hot summer when I was like, 8 months pregnant?
Yes. Yeah.
And not to mention, my baby was 10 pounds. So I was miserable.
Mm-hmm.
And there's just mess everywhere. And I'm
She's having a panic attack.
I was. And actually, my son knows about it because he started using the electric beaters. And then he was like, "Oh, it's too high. Like, stuff's flying out of the bowl." So he turned them down.
I love it.
Yeah.
I thought it was fun.
It was fun. It was funny.
He's comical. He's a funny kid.
Yeah.
He's a very funny kid.
He
So
is.
tell your story about the funny thing that he did.
So, my favorite mom moment ever
Mhm.
in the 5 years of being a mother. This was like, I don't know, probably a year and a half ago. And we're outside, and I'm cleaning up the yard and pulling these limbs out of trees.
Mhm.
Well, I'm pulling and pulling, and it lets go, and I fall backwards onto the ground, like completely backwards onto the ground. And he's going, "Oh, oh God, Mommy fell! Jessie, Mommy fell!" And it was the funny, I'm totally fine, but I'm still laying there just to see, like, how far this is gonna go.
Yeah. Yeah.
And my husband turns around and looks at me, and he starts smiling, and he's like, "Oh, she's fine." And my son looks back at me, and he was like, like you could just see the relief on his face that I wasn't dead.
I love it though. That's cute. That's really sweet.
It was very sweet.
That's really
And it was right around the same time I was trying to teach him, like, if we're home alone
Mhm.
and Mommy, like, falls down the stairs
Right.
and you can't get her to wake up, like,
Yeah.
what do you do?
Mhm.
And so it was right around that same time. So I was waiting to see what he was going to
Yeah.
do.
What did he remember?
Yeah. So
He remembered to panic.
He did. He did panic.
He's not good in a crisis.
No. And you could just see, like, his whole body. "Oh God, Mommy fell!" It was
amazing. I
to
love
this
it.
day, it's still my favorite.
I love it.
I wish I had it on video so I could just watch it every morning.
Over and over and
Yes.
over. Yes.
It was
Oh,
so
gosh.
funny.
And tell us about your pets. You have lots of pets.
I-
Don't we all? We all here have a lot of pets.
Yeah.
I
I mean, you have the same amount as me, minus the 2
I do.
kids.
I do.
Yeah.
Yes. True.
So I have 4 dogs and a cat
Mhm.
and a husband.
Mhm.
I think he counts.
He counts as one of the animals.
And I didn't say that.
I guess talk about your animals,
Well,
but
yeah.
you mentioned your husband.
Yeah.
Okay.
Sometimes. And then I have the 2 kids. So
Yeah.
yeah, I have 3
It's a
pit
full
bull.
house.
Yeah.
That is a full house. Yeah.
3 pit bull mixes,
Mhm.
a long-haired chihuahua,
Mhm.
and then the cat. My
Okay.
husband just brings things home. So he's probably worse than I
He
am
probably is. Yeah.
because
Yeah.
he doesn't think about when he brings them home all of the care that is going to go.
Who's gonna get to take care of them
Yeah.
when he brings them home?
Yeah,
Yeah.
that's going to go into it, and
Yeah.
all of the money that we spend when someone gets sick.
Mhm. Yeah.
So,
'Cause there's always something going on. When you have that many, there's always something.
yeah.
Always.
So people come in and they're like, I don't have that, and I'm
Yeah.
like, I get it.
Yeah.
I completely understand that.
Yeah.
Because one of mine, there's always something wrong with them.
Mm-hmm.
So I get it.
Yeah.
Yeah. He brought home the cat for Christmas 2 years ago.
Mm-hmm.
I did not want a cat.
Yeah. I think that was the most recent addition, right?
Yeah. Well,
Was it-
besides the youngest baby, yes.
Yeah. Other than your people. baby.
Yeah. Other than my
I'm
children.
an animal edition, but yes. Okay.
And nothing for a while is coming into my house.
She's laying down the law.
I sure am. You hear that, husband? No more animals.
No more animals. Jesse, no more animals.
Yeah.
Oh, man. So speaking of animals and making more of them.
Yes.
That's a really smooth segue.
It was. We did not plan that.
No. We
Today,
don't plan anything
No.
here. It's fine.
especially in our friendship,
Yeah.
no,
No.
it's not planned. Sometimes I just show up at her house. I'm like, hey, I'm here.
It's true. But yeah, tomorrow is World Spay Day. So we thought that we would go through, people call up with questions or ask questions while they're here about spaying and neutering their pets. Obviously, that's a very important thing to do. So Crystal's going to go through some of the questions that we get, some of the most common questions that we get, and I'm going to try to answer them. We'll see. We'll see if she stumps me at all.
It's not possible. She knows everything.
I don't know everything. No. Not even close.
She knows a
Not
lot
even close.
about a lot.
I'm just worldly.
Yeah. She's always learning me something.
Yeah.
Whether
Home
it-
improvements?
Oh,
I don't
yes.
know.
Home
Yeah.
improvement.
Yeah.
Movies.
Crafting, movies.
Crafting,
Crystal seemed
yeah.
like no movies. No common movies. She's not ever seen The Sandlot, which is a huge failure on her part, but we'll get it fixed at some time. We'll fix you. We'll learn you.
You'll fix me up.
We'll fix you up. So what questions do you have for me?
So, will neutering my puppy stunt his growth?
No.
No.
So there's and I think because I cheated and I kind of looked at her list already. This a little bit goes into one of the other questions that she has. So I'm going to answer both at the same time. So as far as stunting the growth, and you're speaking about neutering males specifically. So no, but there's a little bit of a caveat to that. So we do tend to wait a little bit longer for the large breed males to be neutered. Part of the reason for that is newer research has come out and shown that leaving them intact, so leaving that testosterone in place for longer, so usually close to a year, maybe even a little bit over a year, is beneficial to their bone and joint development, because the big guys are more prone to problems like hip dysplasia and cruciate tears or ACL tears. So because of that, the big guys, I will wait longer. So it's not so much from a growth standpoint, like I want them to get big, but I want those bones and joints to develop as healthy as possible. Whereas the little guys, your little like poodles and stuff, they don't need that. They're okay. They're not really prone to those sorts of problems as it is. They also don't grow as rapidly or as much. So those guys, the little ones, I will neuter at about 6 months of age. The big guys, I typically wait to a year if I can. Some of them, because they got the testosterone, they get a little obnoxious. They can start roaming, they can start peeing in your house, hiking their leg, those sorts of things. If we're starting to have those issues, we're done. We're just going to go ahead and get them neutered so we can stop those behaviors, because they have to be a good pet as well. At that point, I don't worry about what might happen in the future. I more worry about how are they now?
What's happening
Yeah.
now?
Yeah, can you tolerate them as a pet right now? Because if you can't, then that changes things,
Right.
for sure. He needs to be an enjoyable pet for everyone. So those guys, I'll wait a little bit longer. So not from like a stunted growth standpoint, but just bone and joint development.
Yeah, I have one like that at home actually. My little dog, my little Chihuahua. Because
Well, he's a Chihuahua.
he is.
Let's be honest.
But I also was afraid to get him neutered before I was in this field. This actually goes into my next question, because I was afraid it was going to change his personality. and he actually started peeing in my house, and it went on for a few months.
That's not good.
And finally, I was like, he just needs to be neutered. He's marking things in my house. I can't have that. And this was 10 years ago.
Yeah.
But I waited until he was like a year and a half old to get him neutered.
And now it's a habit.
It is.
Now he just does it forever.
Yeah.
So, yeah.
He has certain things that he marks now. It's not everything. Like, if you come to my house, there isn't pee on everything. But it is something that I should have taken care of a lot sooner. And hopefully it would not have. Like, plastic buckets. Like, if you have a 5-gallon bucket.
Why a bucket?
I don't know.
That's so
I have no idea. But he will pee on it every time.
So, Jaeger.
Yeah.
He's a stinker.
He is.
Just a nice thing to call him.
He is. He is a stinker.
He is a stinker.
So will it change the personality?
Typically, no. Their basic personality is not going to change. It might mellow them out a little bit, but usually that's not a bad thing. Yeah, it's not a problem. That's kind of a happy side effect. But no, it won't. It won't take a very, very nice dog and turn him mean, or make him so that he's standoffish, or he doesn't love you anymore.
Yeah.
No, nothing like that. So yeah, no, it's not going to change their base personality. It just might chill them out a little bit, which is a good thing.
Sometimes they'll gain a little weight.
You know what? Yes, because they're not burning those calories doing the unwanted behavior. And the solution to that is just cut back on their food. It's that simple. If they're getting overweight, and we'll get into one of your favorite topics, which is pet obesity. I think that comes up in October, is Pet Obesity Month. But you cut back on their food, man. Just feed them less. Saves you money.
Yeah.
There's no reason to keep feeding them the same amount if they're gaining weight. So we'll get more into that.
We
Crystal
sure will.
loves talking about
I do.
weight loss and things like that in pets. She loves it. So yeah. We'll do that at a later time. Yeah.
So you'll see me again. Don't worry.
Don't worry. You get to experience this again.
Aren't we awesome? What age should I get my dog spayed and neutered?
So spayed. So even with the newer research that has come out that says that there is benefit to leaving the females intact longer as well, more from a standpoint of cancer reduction. So there's certain cancers that are reduced if you leave them intact longer. The downside is there are certain cancers that are worse if you leave them intact longer. So to me, that's kind of like a wash. So I typically say spay them before their first heat cycle. So at 6 months of age, we should be spaying the females for sure. And then, like I said, the boys, it just depends on size of the dog and what's going on. But anywhere from 6 months to a year on the boys.
Let's see. So that kind of went over the benefits
Yes.
of getting them spayed or
Yeah.
neutered.
Yeah. Nobody wants to deal with an unspayed female.
No.
No. You don't want that. You don't want that in your house. No.
Luckily, I have never had to deal with that.
No, me either.
Not personally.
And to, there's so many animals in the shelters and puppies. There's litters of puppies that are being born in these rescues and these shelters. We don't need more.
Right.
We're okay for a little bit. And I'm not talking about the responsible breeders. That's a different conversation. I'm talking about the oops litters. We don't need any more of that. Let's prevent that from happening. Get your dog spayed.
Yeah.
Mm-hmm.
And my advice, if you're thinking about breeding your dog, go to a couple shelters, 2 or 3. Pick 2 or 3. Any random. Go look at all the puppies that are there, and just really think about it.
Yeah.
Is that something that you want to be contributing
Right.
more to?
For the love of all that is holy, stop breeding the pit bulls, please. I love them. She has pit bulls. I have pit bulls. I love them so much, but there's so many in the shelters. Let's just take a break for a little while.
Yeah.
We can make more later. It's fine.
If
But
we
let's
start running
just-
low.
Yeah, we'll be fine. Because let's be honest, there's going to be people that are still going to be breeding them. But in general, don't breed your pit bull. The puppies are really cute and they love them all, but let's not. There's plenty.
Yeah.
Mm-hmm.
They're so cute.
They're-
Don't get us wrong. It is my favorite
love
breed.
them. Yes, it's my favorite as well.
But like she said, there's so many that need homes.
Yeah.
That we can't save them all.
Yeah.
And people like us who want to save them all.
It's heartbreaking.
It is. It is very heartbreaking.
And then I wanted to bring home more dogs, and then my husband threatens to divorce me. So
he never will. But
he wouldn't. But you know.
But he threatens it.
No more animals. No more.
No more. What is the recovery like after surgery? What should I expect?
Yeah, so after surgery, so typically, like I said, I think does this go to your other, you have another question kind of similar to this. Like I said, I cheated, so I looked at our questions. So this kind of goes into that too, where, you asked if they need to stay the night. No, they do not need to stay the night. You know what, especially here, and really most clinics, I don't think have anyone staffed overnight. So there's really no reason for your pet to stay there. If nobody's going to be there to watch them anyway, what's the point? They're better off going home with you. And with all the good pain meds and stuff that we use, they're typically pretty comfortable going home and monitoring. We usually watch them for several hours after surgery to make sure everybody's recovering okay. So yeah, there's no need for them to stay overnight. So they go home the same day, typically in the evening. So that night, sometimes they're a little loopy from those good pain meds. They might whine a little bit, or yelp, or be just a little bit out of it. We like to say that they're seeing the purple elephants. So sometimes they're a little off that night, but typically by the next morning, they're kind of back to normal. We send home pain medications. They should all be getting pain meds after surgery. Don't let anyone fool you and say that, well, they don't need it, or, it's good for them to be in pain a little bit because it keeps them calm. No, we have other ways to keep them calm. Let's control their pain, because especially since, animals can't really tell us when they're in pain. There's certain signs that we can look for, but those signs are often subtle. And so, by not giving the pain medications when they need it, I don't think that that's kind. No. I think we need to be kind to our animals. And I would rather honestly treat pain that's not there than have them be in pain. That's just how I feel.
Yeah.
So they'll go home typically too with the cone of shame or some version of that. There's different options now. They have like the neck brace looking one. It's the bite not collar. They have the inner tube looking things that are called cloud collars. Whatever is going to keep your pet from licking and chewing at that incision, do it. And especially if you're not going to be home or for overnight, that's their favorite time to get into trouble and start licking and chewing.
No one's there to stop them.
No one's there to stop them. So they're going to try to do that. So they need some kind of device to prevent that, so that we don't have big open incisions and infection and that. So
requires another surgery.
We don't have to do surgery twice. So put up with the cone for like a week, and then after that you should be good. I close the vast majority of my incisions. I close with stitches that are buried underneath the skin, so I think that's a little less irritating to them. It also means that once that incision is sealed up, they're usually good. So like I said, I usually do about a week to 10 days on the cone or whatever option you decide to go with. And yeah, they heal nicely. So if you just put up with it for a week, great, you're done. Rather than kind of half doing it for that week and then they get into trouble and now you're having to do another week or two. It's worth it. It's temporary. Just suck it up. You'll be fine.
And I will tell you from personal experience, because of course one of mine had surgery to remove his tail, because he had happy tail.
Yeah.
And I was in the kitchen doing the dishes, and I was like, oh, I'm in the kitchen with him. Like, I have gates blocking my kitchen, so we couldn't go anywhere. I'm like, I'm just going to take the cone off for a few minutes while I'm doing the dishes. No, I forgot for like 5 seconds.
Yeah.
And I looked back around, and he was chewing at his tail.
That is all it
is.
And we get it. The cones are miserable. They're not fun. And that's why there are other options available that we can look into and try. It doesn't work for everyone all the time. But it's just deal with it for like a week. It's not that long. It's not that bad.
Yeah. I feel like they know, and they will purposely run into your calves.
Yes, they run to the back of your legs, and it's
with the
the
cone.
worst. every doorway and stuff. Plus, too, if you give it a day or two, typically they're running into doorways and furniture. That typically gets a little bit better at least.
Yeah.
Maybe
they
not 100%, but I think they know what they're doing.
Oh, they know.
Like, get this card off of me. Get it off.
Uh-huh.
But yeah, so the stitches that we do here, like I said, they're buried, and then just a little bit of tissue glue is put over the incision, so we don't have to take out stitches typically. If there are skin stitches in there, those come out in 10-14 days. We remove those, even though it's absorbable suture. It takes a long time for that stuff to absorb, like months. So we typically will still go back and take it out, just so it's not sitting there and something to annoy your pet.
Yeah. Why are you not sending home antibiotics?
Yeah, so they really shouldn't. For most surgeries, spays, neuters, mass removals, most of the time, they don't need antibiotics. You know, if we've done a thorough job of clipping and scrubbing for surgery, and the surgery is done in a sterile manner, meaning that they're draped in sterile instruments, sterile gloves, you know, all of that, cap and mask, yep, depending on the surgery, sometimes a gown for the bigger ones. You know, if you're doing all of those things, that surgery should be very clean. There's no reason to do antibiotics. And actually, there's been research out that says that doing antibiotics when they're not needed can actually cause more of a problem than just skipping them and, you know, monitor for a problem and treat at that point.
Why is that?
I don't know.
I stumped her.
See, I don't know. I don't know, but yeah.
And her favorite thing is to be like, why do you think that is?
That's the teacher in me.
Well, I just asked you, so clearly I don't know.
What causes this? I'll be like, what do you think causes that?
Yeah.
It's really annoying, isn't it?
It is. Because sometimes I'm like, well, now I just feel dumb.
Yeah.
Like, I don't know.
You're like, I don't know. That's why I asked. Thanks, though. Thanks for your help.
But it does help me remember some things.
But yeah, I don't know what the exact mechanism of action is of that, of why they're more likely to have problems with the antibiotic, but I don't know. They just are. And really, like I said, if everything is done correctly, if you keep them from licking and chewing at the incision, there's no need for antibiotics. They're good. So,
perfect. Why is there such a price difference between clinics? Like with us here, and there's, you know, a few other
names.
I would say there's a few other clinics.
There's clinics, you know, all over the place, and there's different. You know, there's like the low cost things, and then, you know, there's all these different ways of doing things. And I think that's the big thing to keep in mind is that, you know, if a spay is $200 at this place and it's $80 at this other place, you need to find out why. What are they doing differently between the two? You know, is that $85 place using sterile packs for everyone? That's a thing that doesn't always happen. Are they getting IV fluids? Are they getting pre-surgical blood work? You know, what kind of monitoring is being done while your pet is under anesthesia? Because to me, anesthesia is a big deal. It's a really big deal. And it needs to be done correctly. So, you know, I think that you have to look at don't just look at the price. Look at what is included. Ask those questions. You know, does that include the pain medications afterwards? Some people, are they getting pain medications? Are they getting pre-op pain medications? Because treating pain before it happens is far more effective than waiting until after the fact. Because they get that wind up where it's just more and more and more, and if you try to stop it afterwards rather than preemptively giving, it's called preemptive analgesia. So rather than treating it ahead of time, you're treating it afterwards, you're already behind the 8 ball. It's a little too late. It's going to be a little less effective, so it's not as good. So those are, you know, do they get an IV catheter? Yes, we do. Every patient gets an IV catheter. Every patient gets IV fluids. You know, these are things that are important, and there's reasons for that. We won't go into all of them. That's very technical,
right.
But yeah, there's reasons why we do these things. So yes, our price is often more than $80. But there's a reason for that. So to me, I wouldn't want to go with the cheapest place for my pets, because my pets are my babies. Those are my kids. Yeah. They mean a lot to me, and I want to know that I've done everything possible for them to keep them healthy and safe. So for me, I wouldn't just look at the price. I go with, who's going to do the best job. When my own dog needed surgery, was it last summer? I didn't call around and price shop for it. He needed surgery. I took him to the person that I thought was the best, because that's what was important to me. So yeah, that's my soapbox on that.
Yeah, and it's fair.
Mm-hmm.
I mean, one of the big things you mentioned was monitoring anesthesia,
Mm-hmm.
because even the slightest change
Mm-hmm.
could mean a big deal. So if there's no one there watching, dedicated to your patient,
Mm-hmm.
like here we have
Yeah.
a technician that follows them the whole surgery from
Yeah.
start to finish.
Yeah.
And then even after the surgery is finished, we go back and we check their temperatures and we check their heart rate and make sure that we're doing the best we can for them here.
Mm-hmm.
And that's a huge deal, because not everywhere does that. And
Just
like,
crazy to me, and that's what's so weird to me, is that there's places that don't do those things. I don't get it.
Yeah,
I don't get it, but
we've heard some horror stories, but yeah, I mean, that's just find out what all is included.
Yeah.
Like we also, a big thing here that you didn't mention, we intubate them.
Yeah.
So they have a breathing tube
Mm-hmm.
in case they're not breathing on their own.
Because they often, while they're under anesthesia, they're not conscious, so sometimes they need a little help with their breathing, and so we can give them additional breaths if we need to. Yeah.
Exactly.
So fluids, that maintains blood pressure, which is important. We monitor their heart rate and rhythm with an EKG. We monitor their oxygenation with a pulse ox. The little thing that goes on your finger, the little clip on your finger. That's what that is it's monitoring how much oxygen your cells are carrying. So that's an important thing to know too, because we don't want them to get too low on oxygen. That's bad. And two, even on the other side of things, we don't want them to get too deep. We also don't want them waking up on the table. That would be bad.
Yeah.
So, that's why we have someone that is dedicated to them. So it's not just me. I'm not doing surgery and monitoring your patient, because what am I going to do about it? I'm sterile, I'm scrubbed in. If there's a problem, I'm not going to be able to react as quickly. So that's why it's important to have a dedicated anesthetist there by their side.
There's something wrong with the surgery,
Right.
and then something's going wrong with the pet.
Right.
She can't do both things.
Do both. I'm good. I'm not that good. I got skills, but I only have two hands, so. Yeah.
So that is very important as well.
Yeah, it is. Mm-hmm.
Because, like I said, the slightest change could mean that something is going wrong,
Mm-hmm.
and you want to catch that as soon as possible.
Yeah. And I mean, honestly, 90+% of the time, they're fine. There's no need to, there's nothing that we need to adjust or anything that we need to change, because we've done things, the correct way. But
safe as possible.
do you really want to risk that 10% of the time that we do need to make an adjustment? We need to adjust how much anesthetic they're taking in. We need to adjust, their fluids, because their blood pressure's down a little bit. I don't see a point to risking that. So, yeah.
Right.
Like I said, soapbox. Sorry.
No.
Sorry.
I think that, because not everyone knows these things.
True.
You don't know when you're calling
Yeah.
around what all is included.
Yeah.
And sometimes you don't think to ask.
Mm-hmm.
You just look
And
at the number.
Yeah, we do have people who'll call up and they'll just be like, "How much is this pay?" And you tell them, they're like, "Okay, thanks. Meh, too much." Well, what are you comparing that to? Is there somebody that's providing the exact same level of care that we are for half the price? I doubt it, because I don't see how they could afford to do that.
Right.
So. Yeah.
Yeah.
What else you got?
Do we have to do the blood work?
Yes.
Why?
Yes.
It's a puppy.
It's a puppy. And again, 90-something% of the time, it's going to be normal. It's going to be fine. That blood work is there to catch the rare, 5 or 10% that there is an abnormality. And oftentimes that abnormality is not something that's going to change whether we're doing the surgery or not, although sometimes it is. It has, we've had things before where it's like, oh, surprise, they're in kidney failure. But it's early, so they weren't showing any symptoms. And so that, maybe we put off that surgery. Maybe, that mass removal for that lipoma is a little less important now. But yeah, in puppies and kittens, typically they're going to be healthy, but occasionally they're not. And I'd rather pick that up before surgery, and we can adjust our anesthetic plan, we can adjust what we're doing as far as fluids, and address those things and be better prepared for it so that we're not having a problem while they're under anesthesia, and now we're reacting to it instead of being proactive. So I think that that's important. So that's why, yeah, most of the time the blood work is just fine, but when it's not fine, then it becomes very important. And we have no way to predict who's going to have normal blood work and who's not.
Right.
So,
Especially if there's
I've seen puppies and kittens that have had abnormal blood work enough that we've not wanted to do surgery on them. It's important to catch that, for sure.
Plus, it gives us a good baseline.
It does
for the rest
future.
of
Yeah, for the rest of their lives. You know, that's nice to have that, so we know even if it is all normal, perfect. These are their normals. Because when we do blood work, the reference ranges that we look at, so we have the value that your pet's blood had of, let's say, blood sugar, just for funsies. So for blood sugar, you know, we know what your pet's number is versus like a normal range. That range only covers 95% of pets. There is a random 5% that aren't covered in that. That's how they come up with those reference ranges. And so, you know, it's nice to know what's normal for your pet, so that later, if they're sick and we're running blood work and we see that number, we're like, oh, well, that's what they had before when they were healthy. That's probably just normal for them. That's fine. Let's not get freaked out by it. Let's look at other things and focus on other things.
My pet doesn't seem painful. Can I stop giving the pain medications? Or he never seemed painful, so I
just didn't give it. Yeah, my favorite is the people that come in. Oh, I've got a bunch of those pain meds left over from when she was spayed, and I'm like, why?
Well, you shouldn't.
You shouldn't. So again, this comes back to, you know, for me, I think it's very important to control pain in our patients. You know, it's something where they can't talk to us, they can't tell us that it hurts. The signs of pain in animals, they're basically designed to hide pain. So especially cats, but dogs too. You know, some of them are very stoic, and so because those signs are so subtle, I don't expect that most people, even on just like a cursory look, sometimes I can't tell that they're painful. But two, you know, even people at home, they're not trained to look at those signs and visualize that and know that that's what's going on. So I think because of that, just give the dang pain meds. Plus, I don't know if anybody else has ever had surgery.
I had 2 C-sections.
Yeah.
So
have you ever had a hysterectomy? Have you ever had a vasectomy? I bet you wanted some ibuprofen afterwards.
At the very least.
At least. So, I mean, that's, you know, not a lot different than what we're doing here with these spays and neuters. A spay is removing the uterus and the ovaries. So it's actually a little bit more involved than a hysterectomy. So those girls need some pain meds. They need it. Same thing, the boys, you know, like I said, a vasectomy is a little bit different. In a neuter, we're actually removing the testicles, but that's ouchy. They need pain meds. Just give them the pain meds. Don't save it for later.
Right. They're cheap enough.
Yeah. Yeah, we're not talking hundreds of dollars worth of medication. We're talking about like $20 of medication. Just give them the pain meds. We prescribed it for a reason.
I know after my C-sections, I wanted some pain meds.
Yeah. You got the good stuff too.
I did. I did get the good stuff.
Oh, goodness. And
but I'm also like the dogs. You know, I get up and I'm like, we gotta get this done. We gotta do this.
Yep.
And then I'm like, oh,
yeah,
that hurts.
And you know, there's not, because of the medications that we use and because it's in animals, I've heard some people being worried about, oh, are they gonna get addicted to it? No, man, like, you're gonna be dosing them anyway. They can't go.
They don't have thumbs.
They don't have thumbs. They don't have thumbs. So they can't dose themselves. They're not gonna get addicted to it. Also, typically what we use are non-steroidal anti-inflammatories, so similar to us taking ibuprofen. So it's not like we're using like big gun opioid pain meds that's gonna make them all knocked out or high or get them hooked on it. It's not like that. Don't be worried about that.
Plus, it's such a short amount of time.
It is.
It's not like they're on it for months.
Right.
So.
Yeah, not really a concern. Is that all you had?
That was it.
Cool.
I think we went over 10 minutes.
That's okay.
Our goal today was 10 minutes.
We'll see. Like I said, just keeps getting better, right? All right. Well, if you don't have anything else,
No.
I don't have anything else.
I don't
All
think
right,
so.
everybody. Have a wonderful rest of your day. Bye.